There's been some great news with the recovery of Damar Hamlin after he experienced his cardiac arrest on Monday night. So, at the University of Cincinnati Medical Center, Dr. Timothy Pritz said Damar Hamlin was turned onto his stomach because there was evidence that fluid could be backing up into his lungs, and that he did demonstrate evidence of ARDS, or acute respiratory distress syndrome. So, what is he talking about here when you're putting a patient who's on a ventilator in the prone position, meaning onto their stomach? Well, fluid backing up into the lungs refers to when the person's heart is not beating well, and fluid can sometimes flood the lungs, therefore making it difficult to oxygenate the patient. This is known as cardiogenic pulmonary edema, sometimes referred to as congestive heart failure. But that is not the same as ARDS, which is acute respiratory distress syndrome, which is severe inflammation in the lungs with many different causes. ARDS is actually non-cardiogenic pulmonary edema. Both cardiogenic pulmonary edema and ARDS are fairly common after someone experiences a cardiac arrest. But the only time that we put a ventilated patient in the prone position is if they have ARDS, either moderate or severe ARDS, and it's usually when they have severe ARDS. And the whole reason for that is that you're trying to open up those alveoli to improve oxygenation. How do you tell the difference between cardiogenic pulmonary edema and ARDS? Because they both can have very low oxygen levels, and they can both look the same on a chest x-ray and on a chest CT scan. Well, the answer is it all comes down to assessing the left ventricle of the heart. If you see that the left ventricle is functioning normally, for example, based on the echocardiogram, which is the ultrasound of the heart, then you can say you're dealing with ARDS. Now, based on that, and based on the fact that these doctors confirmed that Damar Hamlin did have ARDS, that tells me that his heart is pumping normally. They did say that he underwent targeted temperature management protocol at the hospital, also known as therapeutic hypothermia. In other words, they cooled his body to about 34 degrees Celsius for 24 hours. Now, therapeutic hypothermia, that's very typical after someone experiences a cardiac arrest, and it's in order to prevent or mitigate any potential brain damage from the lack of oxygen that was experienced during the cardiac arrest. Now, I was actually somewhat surprised they did this based on a report that Damar Hamlin was awake before having the breathing tube put in. The reason why that's significant, when someone is awake and following commands, there's no brain injury, so therefore there's no need to do therapeutic hypothermia. But who knows, maybe he wasn't actually following commands before they had that breathing tube in, so they felt, well, if we're not able to properly assess his mental status and he can't properly demonstrate that he's able to follow commands, then let's rather play the cautious route and go ahead and proceed with therapeutic hypothermia. Now, Hamlin's doctors emphasized multiple times that Hamlin has a ways to go. So, what is the next step? As these doctors said, the next step is to try to wean the amount of support from the ventilator to the point that he doesn't need that ventilator anymore. So when can they take him off the ventilator, meaning take out that breathing tube? It really depends on the patient, and every patient is a little different, but generally speaking, liberating someone from the ventilator isn't done unless they meet the following criteria. So what are the 6 main criteria for liberating someone from the ventilator? The first thing you want to do is to make sure that the underlying cause has been fixed, or at least stabilized. So in the case of Damar Hamlin, he had a cardiac arrest. We're not sure exactly with 100% certainty what caused it, but it seems like it was commotio cordis causing that. So that set him into ventricular fibrillation, and that's been resolved. He's not been having recurrent episodes of ventricular fibrillation, so that's been considered stabilized. Therefore, he would check off that first criteria. The second thing you want to look at is how much support are they requiring from the ventilator. Ideally, they don't need any support, but even if they had minimal support, that would be considered an adequate box to check off for that criterion. And this is why the doctor said, we want to see him continue to breathe more on his own, and we want to get him breathing completely on his own. That will be the next big milestone for him, and that's absolutely spot on. Okay, the third thing is the mental status. You want to see that they're following commands. Now, obviously, Damar Hamlin's mental status, his neurological status is intact. He actually, when he woke up, he wrote down on the clipboard with a pen, and his first question was, did we win? So yes, his mental status is intact. The fourth thing you want to look at is, are the vital signs stable? Is the heart rate fine? Is the blood pressure fine? Oxygen saturations, the respiratory rate, are all those stable? The fifth thing you want to make sure is that the patient has a strong cough so that they can bring up secretions, they can cough up those secretions and therefore protect their airway. And the sixth thing is, sometimes when people have a breathing tube in, the tube has a cuff on it and it's secure the tube in the place of the airway, and that can sometimes cause laryngeal edema. So Swelling in the airway can actually be a problem once you take out that breathing tube, and people can have respiratory distress as that swelling causes narrowing of the airway. So you want to make sure that they don't have any issues with that. So basically, if all those 6 things are checked off, then you feel really good that the patient is going to have a successful extubation. And as his doctor said, taking him off the ventilator is going to be a cautious, gradual process. Everyone is different. Some people with cardiac arrest get extubated within a couple days, some people a couple weeks, sometimes it's longer, or it could be anywhere in between. And keep in mind that whenever someone is in the hospital, especially in the intensive care unit, there's always the potential for complications and setbacks. Now, there's always the possibility that someone develops pneumonia as a result of being on the ventilator. There's a possibility that the breathing tube can cause that laryngeal edema. Someone can develop a blood clot in the legs, and that can travel to the lungs and the heart. There's also the possibility that someone has a bloodstream infection, meaning sepsis, as a result of the IV catheters from the skin. So there's all sorts of things that can go wrong. I'm forgetting like 100 right now, but there's a ton of things that can potentially go wrong in the intensive care unit. So just because everything is going smooth, it doesn't always mean that everything is gonna be smooth. So that's why the doctors are right to be very cautious in what they're saying and have a very cautious approach, and say that the best case scenario is that he gets back to how he was before that game started, or before that play happened. So that's the best case scenario, and they are being very cautious with the prognosis. But no doubt about it, so far it's been so good in terms of his recovery process. The doctor said that tests are still underway to determine what caused that medical emergency, and that there are no definitive answers at this time. Dr. Knight said they aren't ruling out commotio cordis, but it is too soon to tell without further testing. Now, I get it. You want to be sure you get the accurate diagnosis, and you want to do your due diligence to make sure that there's not something else that caused the cardiac arrest. Is there the potential that there's an underlying cardiac condition, such as long QT syndrome, or Brugada syndrome, or ARVD, arrhythmogenic right ventricular dysplasia, or hypertrophic cardiomyopathy? Yes, all of these are on the table. But in the context of how it happened, when it happened, and what happened, well, there is a saying in medicine, and it goes, if it looks like a duck, and it walks like a duck, and it quacks like a duck, it's a duck. Especially when there is no test that can prove or disprove the diagnosis of commotio cordis, because it is a clinical diagnosis. But regardless, I'm so happy for Damar Hamlin in his recovery. That is a huge step. He has many obstacles that he still needs to overcome, but by far the biggest 3 obstacles he's already overcome. He already survived the cardiac arrest when they did immediate CPR and defibrillation, and that he has neurological recovery with his brain. He didn't have any brain damage as a result of that. So definitely those are the 3 biggest hurdles, and it seems like he's making a lot of progress on the ventilator, and that next big hurdle that he looks like he hopefully overcomes is getting that breathing tube out soon. So glad for him, and I'm glad in his recovery.